Have you ever had a client so chaotic in his or her presentation that you literally didn't know where to start? Hey, I've had this happen to me lots of times, and I know how frustrating it is to just try to sort through everything and to not be making the kind of progress you'd like to make. Luckily, there's a tool for this, and in DBT we call it the diary card, and I'm going to tell you about this effective tool today and share a PDF of a couple diary card examples so that when you have a client who comes in a chaotic place, you can sort through everything, figure out what the priorities are, and have an effective session and see your client do better. Hi, I'm Dr. Lane Pederson. I'm the author of Dialectical Behavior Therapy, a contemporary guide for practitioners, and the expanded Dialectical Behavior Therapy manual. In addition to training internationally on DBT, I'm a real-world practitioner. I've overseen the treatment of thousands of clients in what is one of the largest DBT practices in the United States. And I'm so excited to talk with you today about the diary card and to share this tool with you. To illustrate the use of the diary card, I want to talk about a client I worked with early in my career named John. Now, John had a very chaotic life and he had a lot going on. He was suicidal at times, so he had that suicidal thinking and urges, and occasionally he would act on behaviors that were life-threatening. He struggled a lot with alcohol and drug abuse and addiction. He also had a lot of therapy interfering behaviors. He would sometimes not show up to session, or wouldn't complete the homework expectations, or would have other things that would get in the way of him having effective treatment. And of course, he struggled a lot with depression, anxiety, at times with anger, and then other behaviors that just interfered with him having a decent life. A lot of conflict with his wife, who was very distressed by his different behaviors, and he was working but wasn't functioning very well at work, and in particular would blow a lot of work deadlines, which kind of kept him in hot water with his boss. So there was a lot in any particular session that you could potentially have to focus on. Now, the diary card is our means of having the client self-monitor what's happening between sessions. And I want you to click on the link for the PDF of diary card examples so you can put a visual to what I'm going to be describing verbally, and I think that's going to help make this a bit more real for you. But what we're going to have the clients do, and a client like John do, is record the diary card at the same time every day for the previous 24 hours so that a client like John can track what's going on in terms of symptoms, in terms of urges, in terms of target behaviors that we want to change. And of course, in DBT, we teach all of these different skills, and we want the clients like John and all clients to be tracking their skill usage too. Now, anything important to treatment you can put on the diary card. You can put treatment objectives themselves on the diary card, which is wonderful. And I like to tell people, customize the diary card to your setting and your population. If you're working with people with eating disorders, you'll want to track eating disorder behaviors. If you're working with people who need chemical health interventions, you're going to be tracking urges to use, behaviors that interfere with recovery, etc. So the examples I'll give you will give you a starting point, but know that our ultimate goal is making it really applicable for each individual client. Okay, so back to John. He had so much going on. Without the diary card, I would have been completely lost about where to start and what to do, and just kind of wandering in the wilderness, if you will. But the beautiful thing about the diary card is it really helps clients, and it really transforms how effective you can be as a therapist. And let me start with how it helps clients. First of all, anytime that you want to change anything, it helps to track it. What you track and what you focus on is what's going to change. And I know this from my own life. Anytime that I want to increase exercise, I track it. Or anytime I want to make a health style change, I create a schedule and I monitor that data every day. In essence, I'm creating my own forms of a diary card. Well, when we have clients complete the diary card as we present it to them, they're accountable for knowing what's going on in their lives, what's happening with their symptoms, and what they're doing actively to address those different problems. And so we start seeing change happen just through this increased monitoring and awareness on the part of clients. Now, I said for therapists it's transformative. Here's why. When a client comes in with a completed diary card and you see everything that's happened since the last session, like that, you just have a wealth of information. and you know what your top treatment priorities are going to be, and you know what topics and what concerns are just going to need to go by the wayside. Now here's a tip. In DBT, we radically accept that people have lots of problems in order to focus on one problem. And with the diary card, not only are you able to pinpoint what's going on globally, but you're able to prioritize what's most important right now to deal with. So if John came in and he was feeling suicidal and might be at risk for acting on those urges, that's the top priority. That's what we're doing first. If on another day he comes in and things are pretty squared away in terms of his suicidality, he's not struggling with urges, but he's struggling with chemical use issues, that's our main thing that we're going to be focusing on. At other times, that maybe was less of a problem, but treatment interfering type behaviors were coming on. Maybe he felt like he wanted to drop out of treatment. Then we might focus on that. Now, part of what I'm alluding to here is that there's a hierarchy in DBT. Our traditional DBT hierarchy is that we deal with suicide first, self-injurious behavior second, treatment interfering behavior third, okay, and then underneath that, all kinds of quality of life interfering behaviors. I'm really an advocate of following the DBT hierarchy, and if you got training from me, you'd see me talk about that in depth. But the main point here is you need to know what to treat when. You need to know with the person in front of you, like John, what the most important treatment topic is going to be. And the diary card brings that kind of clarity and focus to sessions. So, click on the diary card. Sit down with a client, explain it through. I'm going to include instructions with the diary card about how you might do it. Sit down with a client, explain it through with him or her. Have the client start using this diary card to track what's going on. And you're going to see how this diary card is going to help bring extra focus to your sessions with that client. And before you leave the page today, click on the bottom with the comments and just leave a brief message about how you could see the diary card being useful for you in your practice.